Okay, good afternoon, everybody. So my name is Maria Marques, and I'm here with Nenad Živković from Gnomon. I come from Uninova. Uninova and Gnomon are both partners in the xShare project, where we have the ambition to deliver the xShare yellow button, which is able to provide, or which will be able to provide to each citizen and patient around Europe with access to their health data as stored in their national infrastructures, hospitals and clinics and so on. So as part of that work, we have been developing some technical content and working around specifications for the adoption, let's say, of the xShare yellow button, and it's part of that work that you will be seeing today. Unfortunately, we have one speaker that was not able to attend today, which is Nathan Carvalho, but we have a plan to manage this, and I think that we will have a very interesting and fruitful session. So for starting, I will like to invite my colleague Fábio Januário from Uninova, who will be presenting the yellow button use cases. So Fábio, the floor is yours.
Hello, good afternoon. My name is Fábio Januário. I'm from Uninova Research Institute in Portugal. And yes, I will talk a little bit about the use case of the xShare yellow button, what is the intent of and the objective of this button in the context of the xShare project, that is the expanding the European exchange electronic health record exchange format, that I will say just exchange format to simplify in the rest of the presentation, to share and effectively use health data in the European health data space. So regarding the vision of the xShare project, the idea is that everyone can have access to her health data in the exchange format with a click of a button. For that, we are demonstrating this xShare functionality across continuity of care, clinical research, and so on. And we are trying to start this with 8 adoption sites to see the fulfill of the implementation of the xShare yellow button, and also the challenge to this implementation, what you need in terms of technical specifications to this adoption. So we are trying to demonstrate all of these things, and the project is more than just the yellow button, but this session is focused on the yellow button purposes. So regarding the xShare yellow button, the idea is to put these buttons in portals and patient apps that already exist in healthcare providers that enable people to share and download their health information in the exchange format. And of course, we are in mind to make this button align with the European health data space, and for that you need to see some of the important topics in this regulation to, for one hand, have the patient's right assurance in this button and also have the information in the exchange format. Very quickly regarding the patient's rights, this is the information from the European Health Data Space Regulation. The natural person needs to have the right to access their personal health data. This is the objective of the yellow button. This needs to be easily readable and also needs to be optional to be downloaded in exchange format. And to use the exchange format, you have some priority categories of data that is envisaged to be used that I will show later. Also have the possibility to have this access service implemented in the portals with also easily accessible for persons with disabilities, vulnerable groups, and also persons with low digital literacy, and also the possibility to persons to insert their information in their electronic health record in the systems. So the person needs to have this access, and also is needed to be clearly distinguished what is the information provided by healthcare and the information provided by the natural persons. And also the right for rectification and the person see that anything is not right. And finally, right to data portability. So give access to other healthcare professionals to access this data and also to do this in national and cross-border context. Right to restrict access, so say that someone cannot access the data. Obtain information about who is accessing this data, and also the option to opt out. So this is the main articles of the regulation that say the rights of natural person for primary care that you need to consider in the implementation of the button. And also have the exchange format. So the exchange format, it's more or less a kind of standard that is machine readable and allow the transition of health information, and needs to have at least some components such as defining the data sets and the group of information that is needed to be transmitted, the coding systems and the value sets to codify this information, and also the specification for technical interoperability and exchange of this information. And for that is also mentioned in the regulation the priority categories that must be considered in this first stage. And these are patient summary, electronic prescription and dispensation, medical image studies and also the reports, medical test results and related reports, and also the discharge report. So this is the 5 priority categories that we are working on in the xShare yellow button. So with this in mind, now we'll talk about the button itself. And for that, we are thinking about 3 specific use cases, so basic use cases, basic functionalities to implement the button. And there are 3: the download, the on-time share, and the linked options. For all of them, we have some preconditions that you need to fulfill so you can implement the button. So the citizen needs to have an account in any web portal or app that provide this health information. This information needs to have the capability to be exported in the exchange format. If not, needs to be structured and well documented so you can try to mapping this to exchange format. And also you need to have a reason if this information is not available to say the citizen why this information is not available in their system. Now for each of these specific use cases, the first one, more easy, the download. So have the possibility to a citizen download the information in the exchange format, but also in a readable format, for instance, the PDF. So the idea is that citizens access their portal application of their healthcare provider, have there the yellow button, can click the yellow button, can see all the information available in that system, choose what want to download, click download, and have this information. Also optional, where they can have some optional configuration of this data, such as anonymization, pseudonymization, translation of information, digital signature, password protector, and so on. Regarding the on-time share, the first part is the same. We have access to the portal. You click the yellow button, you choose what is the information that you want to share, but also with some optional configuration that you can use. But then you don't download this information, but you create a shareable link that you can send to a trusted one person. And when this person accesses this link, they have the visualization of this data and the possibility to store this data. So you can use this link to share information with a relative one, a healthcare provider, another app. You just need to ensure that the receive person have the capability to ingest the information in the exchange format. If not, just can't see that. And final one, the linked options. It's very similar with the on-time share, but the on-time share is a snapshot of the information. In these link options, this information is continuous updated. So you create a permanent link that you can share, and when the other person in the other side assess this link, this information is automatically updated. This is important, for instance, for the patient summary that is updated during the time with more information. So you have a direct link to this information that is updated. So this is the 3 main functionalities for the button that were envisioned. And for making all of this working, we have the adoption sites in the project. So the idea is to explore the implementation of this xShare yellow button across 8 adoption sites, and we have their group in 4 kinds of context. One of them is business setting context. That is the case of France, with some applications that want to integrate in the national context. Then we have the national context with some national agencies, the case of Greece, Ireland, Denmark, and Cyprus. Then we have also the regional context, is the case of Catalonia in Spain and Madeira in Portugal. And finally, the hospital network context with an hospital in Italy. So we are testing these in different kind of platforms and web portals, from the national, regional, until the hospital context. And just to give you an overview, you start this work talking with all of these adoption sites, and you say you have all of these periodic categories, what you intend to use, what is the data that you want to make available for the patient. And this is the result of this exercise. First of all, we have a new domain that is care plan, that is imported from Denmark. And this is a new periodic category that are being discussing. And you have all of the other ones. As expected, patient summaries, the one that is more expected to be used. But even all of these exercise will be not possible to work in all of these on these categories, because we don't have mature specification for all of them. So you need to start for the ones that are more mature. For instance, patient summary lab reports that you have some specifications at the European level that is possible to use. Prescription and dispensation also. Medical image, it's not so advanced yet. And discharge report, we already have some draft specifications to be used. So you need to align the development of the European exchange format also with the xShare yellow button. But this is the idea. Now we are fine-tuning, starting to work on the download case of the button and also in the patient summary, and then we will improve with the adoption sites with the other periodic categories and the other use case. Just to give you an overview of the work that we are doing with the adoption sites, first of all, we define the business use case for each of them that is available in that link. Then you make an exercise with user stories with many actors. So the citizen, the healthcare professional, the IT team. So try to understand all the user stories that you need to think about to use the button. Then you make a distillation of all of these user stories, and you make a final compilation in these 37 reference user stories, and you make a final definition of 30 requirements to think in the implementation of the yellow button. You have just here some of them, is more than that, but one of them is accessibility. You need to have a portal or a web app to put the button, the login component to record all the transactions that are doing with the yellow button, the function selection, so you can select the functionality that you want, data transformation, data selection, format selection to put the information in the exchange format, and so on. The download, the sharing. Also, you need to have the visualization of the information that is available. So you have many requirements. And with that, you make a first analysis of the main components that you consider for this button. So this is a figure just to show the main components that we are thinking about. So of course we have the xShare node with all of these components. You need to have a way to catch this information. Then you can use the My Health at You infrastructure wallet, or you need to have a custom API to have access to information. We are seeing different options in different adoption sites, but then we have many components that you can use to build the button. The first one is the interoperability component, is that one that is responsible to map this information to exchange format and also validate that information is in its correct format. The sharing component, responsible for this share functionality in the on-time share and also in the link options. The auditing component to make all the logging of the operations around the button, and final, the data transformation component where you put all the tools with the option, the option transformation that you can do in the data. Pseudonymization, format converted for a readable format as PDF, translations, digital signature, and so on. So our analysis with the adoption site, what is the important features to go there. And this is our idea and how you are managing these main components. Now you need to go a step further with more technical aspects that Nenad will be presented with some architecture, I think, because for my side, I have a second presentation that we'll leave for the end of the session, that is the implementation guide, because this implementation guide have all of the information that we'll share in the next presentation, so you'll give this one for the end. But this is the link. If you want to save the link for the final of the session, you can save it. Thank you.
Are there any questions for Fábio at this moment? Yes?
Hi, this is Jan from Živković and Živković. So what I would like to understand is that especially for the upload functionality, how are you handling the security aspect? Because any kind of upload, especially for any sensitive data, is
Yes. And because of that, you see that upload is outside the xShare node. Is a reason for that. We're starting to talk with our adoption sites also, thinking about this possibility of upload of information. We focus the download to give access to the person of their health data, so we are focusing the download and sharing part, but also trying to see what is possible to do with this upload. The first discussion is, okay, we can receive data, but we'll put in another way. See, not the storage, we'll put there, and somehow any doctor, any person need to check this data and see if it makes sense to ingest this in electronic health record system or not. So it's very difficult to have an automatical way to anyone upload data to the system, and makes sense to do that. But we are discussing also in our adoption sites to see the possibilities to do that. In any case, regarding the xShare yellow button, you already have a testing scenario with upload, but it's not an upload from the button, not allow the upload, but the shareable link that the button provides is used to upload information in another app. For instance, if you have a personal health record mobile app that you can put all your information there, you can use this information that is shared by the yellow button to put the link in this app catch the information and put there. So it's not ingest information in the electronic health record system, but it's yes in your mobile app, in your systems, in your personal health record system.
Okay, any other comment or question for Fábio now? We will have Fábio later again.
Yeah, again.
I think that now we should move then for the next presentation, which it's Nenad or Argiris. So,
Okay. Okay, so hello again, I'm Nenad. Before we continue, let me remind you all that xShare is about, yellow button in xShare is about me as a patient getting data from clinical data sources. There is no use case, and it's not documented, that me as a patient, I'm uploading something. The IT guy left, and he posed the question and left, not the other one. Okay, so I will present you the architecture. We talked a lot with different set of peoples and different adoption sites, heard about many ideas, what they want, how this should be achieved, and which kind of formats they are prioritizing before any other format. So we ended up with the architecture, which is following. Next slide, please. Oh, sorry. Ignore me. So we ended up with building the architecture by utilizing knowledge that we collected during years, not we as a project consortium, but we as people. And those knowledges are handed to us by the OpenNCP, EHDSI, and by the Gazelle testing suite. So dividing things in boxes which has clear role and responsibilities, so everything can be orchestrated to work together, which also opens the space for people to create the better version of the box, apart from the reference implementation. So everything, as obvious and expected, is guarded by security and privacy layer. Security is based on the internet user authorization defined by as an IHE profile, which is at the back. Am I boring with technical details? No, okay. So at the bottom it's OAuth and OpenID Connect. So you're getting the access token. In order to get the access token, instead of knowing the whole world and every person in this world, we introduce the identity and access management, which will be brokered with existing identity providers of the country of the region. So we are trusting them to authenticate user and provide us with the authorization token, which is then, based on this authorization token, we are issued authorization token just for the yellow button. I will touch privacy later. And as Fabio said before, we need to provide 3 different APIs. So first one is download my data for me, sharing data either one time or continuous sharing, and looking at my data to be able to pick what I want to do with my data, to download just one Exchange format, one clinical document, the whole thing, and to pick what I want to share. So these are services in data management, which are supported by services which are furthering the use cases. And those are that many countries invested a lot of time producing CDA format of required Exchange format. And instead of forcing them to now use FHIR, because xShare yellow button will use FHIR only, we are providing them the transformation service. So CDA produced by health data sources will be transformed into FHIR counterpart before will be available for any of these use cases. Visualization, because FHIR is more friendly than CDA, but still not friendly for humans. So visualization will provide the human readable format for a person, either doctor or either patient. To do that, there is a visualization component which will now do the opposite thing. FHIR format will transform in the CDA and apply the XSLT transformation on top of it to produce the user-friendly format. Anonymization, which is not yet defined, but some things needs to be anonymized for sharing. Those use cases are not strictly defined because we are still waiting to draw the line to which level data should be anonymized, but still useful for some use cases. For all of this to work, there is a data repository which acts as a caching repository. If you imagine this API will be available for patient, and like any other API connected to web or mobile application, patient can click all day long. So instead of hitting hospital information system, for instance, with every request, the Exchange format will be cached in the data repository. Instead of reinventing the wheel how this data will be available to consumers, we are relying on IHE MHD profile, which is the FHIR way of querying, finding, and retrieving documents, because all these Exchange format are documents at the end, clinical documents. Every transaction needs to be audited, so patient can see who accessed data. Maybe some clinic chief information officer or chief information security officer want to see the same thing. Again, instead of reinventing the wheel, there is audit log pretty finely defined how to collect and document access. Consent repository, I will leave it for the late one. So all this data is available in member states and in adoption site, but in different way. And instead of locking the yellow button just to a single implementation and forcing everybody to now scratch whatever they are doing and create a new one, we are relying on the NCP infrastructure, which is present in every member state. But if this infrastructure is not desired to be used, or if hospital wants to provide information directly, or NCP is not connected to hospital, etc., there is also smart links, which Fabio mentioned before. So data source will create the smart link for us, like for any other consumer, to get data from the data source. And of course, the European wallet. So European wallet is a little bit different. You see import, but European wallet has import and export, which is the same thing. So you can think about export as the same functionality as above. So I have my wallet. I can export things from my wallet into yellow button and make it available for sharing. But also, once I get my data using the yellow button, I can put it in my wallet. Sorry. NCP EH and every NCP node last 2 years implemented also the translations, and not last 2 years, but last 2 years exposed these translations also to non-clinical users, aka patients. Instead of us doing the same thing, translation will be available also for all these documents. So my patient summary in Greek language using the yellow button can be translated into English or into Italian if I want to use it in those places. We also talked about custom connectors, because we don't know what people have, what people can expose. Custom is in different color because for now it is on hold. It is undefined thingy, and in order for this to be successful, we need to have defined and clear boundaries what we are doing. And less consent, which will be implemented by design, and it will be automatic. So whenever patient pick what to want to share, based on available policies, again, we are reusing and reutilizing the IHE BPPC profile. So based on available policies, from the policy, the instance of the consent will be created, all transparently to the patient, will be stored in the repository. And from that point on every access, the repository will provide to the decision point this consent to assess and to make decision, allow or deny access. Did I forget something? No, it's a lot, but okay. Any questions? Charles, please.
Yes, Nenad. So that blue box, no, keep the slide. Yeah, that blue box that you call the xShare infrastructure.
Yes.
From the xShare project point of view, is that something that you are developing as a chunk of software that will be
Yes.
reused across?
Yes. So all these boxes which are marked with red icon are deliverables. So this will be the software package as a reference implementation, but more important, it will be a specification how this box should behave and expose itself.
Okay. Could you take me one step back? I am a hospital in a country. I participate to the xShare project. I want to offer the yellow button on my environment. Why do I need this? Because
That's a beauty. So you are a hospital.
I have a hospital IT system.
Yes.
I can add those yellow button FHIR transaction and provide it information I have in my local database in the right format, and I'm done. Why would I need that blue thing? Now, I think I know the answer, but to me that is not obvious. What's the strategy here?
If you as a hospital are performing auditing, you don't need audit box. You need to expose audit record repository for transaction of data management.
Okay.
If you have a repository of clinical documents which are exposed as IHE-MHD, and you are willing to respond to every request, you don't need the data repository box.
Okay.
The same is if you are enforcing consent and you are following policies, not policies, policies are changeable, but if you are following the way how policy enforcement is done, you don't need consent management, neither consent repository. So all you need is this box as a facade on top of your infrastructure.
Okay, so the idea here is this blue box is the worst case for the minimally interested hospital that says, I don't want to change anything on my existing software. I want to externalize thing and have that external thing interface and get data out of my system in more or less standardized ways.
Yes.
So that the yellow button interface and all of those policies and interfaces is not my problem. I have a facade to do that. Thank you very much, xShare project. That's the philosophy.
Yes, so the yellow button, if you want to be compliant, imagine a button anywhere. This button is backed up by some infrastructure at the back. So this infrastructure is data management box. If you have everything else, please start behaving like this and you are compliant. If you cannot afford or you don't want to implement, here is a reference implementation box that you need to deploy in front of your infrastructure.
Okay. Last question. If I move all the way down to your model, to your picture, it speaks to the NCP here. So I don't think xShare is interested or developing or installing NCPs for EHDS. That's outside of your scope.
This is existing. This is not ours. The
So that is
deliverables are red icons.
Yeah.
This is one of the way how to get data. So instead of connecting to multiple hospitals, NCP is already doing this.
Okay.
So utilize NCP for this instead of going directly to hospitals.
Okay. So you do as if you were outside of the country.
Yes,
Gain data
exactly.
inside the country.
Actually, in this case, yellow button is behaving like country B.
Okay, got it.
Isn't that in line with what the Puppet project has been doing?
Yes,
Where providing the patient access to via infrastructure?
yes,
So that's also within country. So you're not playing as if you're outside the country, you're playing as if you're a patient.
the PATED is also implemented like this, because NCP node was designed to be accessed by others across the gap, cross enterprise, cross community. So PATED utilized this to behave like country B to get data for the patient. And we are utilizing PATED project at least in access. So not reinventing and going to the health agency authority saying, drill the hole for the patient, it's already there, but also the translation functionality which is already there.
Okay, got it. Thank you.
You're welcome. I killed people, so good luck, my colleagues. Okay, next one is, should I announce? Next one is the demonstration, early demonstration how we did this in Greece. we are missing one important part. We are all Greeks here, pun intended. But we are missing one crucial part, which is the health agency representative here. Oh, sorry. Okay, we are complete. Idika, Argiris, please come to the stage.
So let's see the video. It's the demonstrator that we did.
eHealth Pass mobile app. With eHealth Pass, Yannis can securely access, manage, and share his health data whenever he needs to. Yannis, through the xShare button, requests to download and import his patient summary from the NCP. While NCP is currently generating the patient summary in CDA format, there is an extension that now allows the transformation of the CDA to FHIR IPS, which is then imported in eHealth Pass. Yannis is having a teleconsultation with his personal doctor, Dr. Dimitris, and informs him about a new drug allergy during his current medication. Dr. Dimitris is updating Yannis' patient summary in the national infrastructure, and then Yannis is notified to update his personal health record in eHealth Pass.
I am now entering the allergy ISO into your patient summary, and this info will be available to any healthcare professional using this system. That way, you won't be given the same medicine again to put yourself at risk.
Yannis is traveling to Moldova, a country outside of My Health at EU Network, and visits a local health professional to address a health issue that just happened. By utilizing the European Electronic Health Record Exchange format, Yannis has the ability to share his patient summary through eHealth Pass either in PDF format or in EEH or XF to be imported by Dr. George's system.
I had the opportunity through the use of a digital health application, such as eHealth Pass, to access the summary of a patient's medical record from abroad in a non-EU country, thanks to the use of the European Health Record Exchange format. The implementation of this format seems to ensure reliable cross-border access for health professionals in a structured form of medical information, while for the patients, the exchange of their health data safely and on various platforms.
Visualization of IPS in EEH or XF on the left and in PDF on the right.
So to be honest with you, this is Yannis.
Hello, everyone.
Yannis is from Idika, the Greek NCP, and now questions or something that you would like us to explain more. I don't know if the demonstrator was enough based on what you have heard before from Fábio and Nenad. No questions? Please.
So if I understood the architecture, you access the current CDA-based patient summary that is accessible by any other country that has an NCP connected both to the Greek NCP and will retrieve that summary. You act in you have a national hub that is getting it just like any other country would, and you transform this and make it available in an IPS / set of resources back to an application. So in a sense, you've built a national yellow button portal.
In a sense, yes.
Correct?
In a sense, yes, but to be precise, when I request to import the patient summary, it first makes the CDA to FHIR, and then I get it.
Correct.
Yeah.
No, I understand.
Okay.
Yeah. Okay.
Robert, please.
So you been implementing the yellow button as a user interface in the Europass Act, or the whatever it is called, the app. But there's part of the infrastructure to deliver on that yellow button is in the EDICA NCP infrastructure.
Yes, and there is also the portal, which we are now trying to see how we can give access to the patient there also, because the cross-border portal has some kind of different regulations, and I think Yannis can give, if you need more information about it, but right now patient cannot access that as it is right now.
Yes. Architecturally, it would be open to other apps to also push the same button and get the same FHIR IPS.
Eventually, any yellow button app could do it.
Good to know.
On that point, if I understand correctly, this app essentially did implement this box which did say data management in the architecture. Is this right? On the upper left.
The app is implemented in the bottom, but there is infrastructure in the back.
Right,
Application is not the whole.
Absolutely. So the app only had the part which was on the upper left part of the architecture. And I think
The app is using the
Can you put the slides back?
which API?
download.
What Nenad showed you was the server side, not the app side. The app side is,
The app side is above, it's not on the picture.
yeah.
The app is using patient data, download, share APIs.
So is the idea to have a standardized interface to the data management box then? So that any app can access it?
That's what EHRF, ALA, xShare, yellow button is assumed to do.
Yeah, I'm wondering at the moment where this is.
Yeah, good question.
So
Where's the app?
where's the app and where's the standardized interface? I saw that you are using inside the infrastructure, you are using IT and HD, but how can any app get access?
This is what I told before, that the box, the app, the deliverable is not software component only,
Yeah.
but also the specification.
Right.
So anybody else can implement the box completely different inside, as long as it responds and reacts in the specified way.
So Nenad, it would have been nice if you had a couple centimeters on top of your drawing here and put a black line
Consumers.
with a box that says patient mobile app.
Okay.
And have the patient mobile app enter from the top into the security layer and into the data management layer.
Exactly.
That would have, yeah.
Then it will be more understandable.
Yeah.
Okay, thank you.
One more question about the NCP EDICA here in Greece. First, what was the software that the doctor used in order to report the allergy? How was it used? And in general, we have 130 hospitals in Greece. Are all of the hospitals report data to EDICA, or 20%? What's the percentage? And the same about like private EMRs. Do they go to?
Yes, thank you for your question. The Greek doctor currently has a user interface to manage the records of the patients. Currently, hospitals are not interconnected, mainly in production environment, right? Only the prescription and some sections in the e-health record system that are available to the doctor to provide information. But we are almost there to have a new e-health record system in Greece that every public or private facility will provide every information for the Greek patient. And it is to be completed in 1 year from now. EIFI. The current name is AIFI. The new one is EIFI. Right. So the important thing is that soon we will have a great collection of information, and everything will be available for EHDS as well, for secondary use, apart from this. Yeah.
And the
Sorry, I don't hear.
Communication between the systems will be with FHIR. How hospitals will communicate with AIF.
With AIF, this is another thing. This is another thing. I think it will be using CDAs, but I'm not fully aware of it right now. Yeah. Thank you. Any other questions?
Nothing, so I guess we go back to Maria and Nenad.
Thank you.
Thank you.
No. I think that now I will invite Robert.
Now, instead of Nathan, more than sufficient replacement. Robert, please take the stage.
Yes, thank you. My name is Robert Stegwee. I'm also part of the xShare project. And unfortunately, Nathan is not here to talk about the industry label, so I'll take over that part and also talk a little bit about the hub and the open calls that are out there. So if we're looking at what's happening, you've just been informed about the yellow button and the specifications around it. That's all great and good in terms of what a user can see, and especially a patient can see. But now let's look at the other side. What do I see if I actually buy an EHR system? The EHDS is very clear that it's a market regulation in part, so EHR systems cannot be put on the market without conforming to the electronic health record exchange format, or, well, I'll spare you the details in terms of the legal background. But and we actually said, from an xShare perspective, we need to investigate whether it's possible to have a label. To have a label that actually tells hospitals or other people that are looking at a system, not just accessing a system through a portal, but really looking at a system, whether this system is already prepared to deal with the electronic health record exchange format and to deal with what's happening. And as a part, also provide the yellow button. So that's what we're looking at. So really, as mentioned before, the project envisions everyone to be able to use a yellow button to actually access, share, link their data with any healthcare provider with a click of a button. And the label needs to be a safeguard that, yes, this application actually can provide that functionality according to the specifications, and it has been tested. Those are the two things that we've identified, and you may have seen that in Fabio's presentation earlier. Then, of course, the vision for that label has been developed over the past couple of months. And yes, there is a need to label things, but it needs to be kind of aligned with other labeling. I mean, we don't want to have a whole series of labels on an application or on a product where you cannot see the forest for the trees. So that's where we really are saying, well, it needs to be integrated seamlessly into other labels. And of course, the CE label is one of them, if you need to have a CE label on an application. If there's more labels like the Health and Wellness app label that SEN provides, if you want to have that on there, it needs to be integrated. And of course, there are differences in this, but that's what we need to be able to do. So it also needs to go, if we look at the second block, it also needs to provide for self-certification. At least that's the term that's being used in the EHDS. My colleagues at the National Standards Institute kind of say, well, there's a misnomer there. There is no such thing as self-certification. It's either certification or self-declaration, but again, that's a different story. But so it needs to be possible through the xShare label to also incorporate this self-checking and self-declaration that yes, I have gone through the steps and I can prove it. Here's the proof, and so I do declare that I'm conformant with these specifications. And in the EHDS, there's also already people and parties that are assigned to provide that testing environment. So we need to relate to that testing environment or have good reasons or good agreements with those national testing agencies that they will accept our tests as proof for their tests. How that's going to work, we don't know yet, but that's what's really important there. In all, this will be a cost to the providers of systems, and that is not something that the xShare project will cover endlessly. Of course, we will invest in a lot of these activities in developing and supporting people to do this, but in the end, there will be a cost attached to regulatory compliance, which is not new to vendors. And to industry, but we need to make sure that it's containable, it's easy to manage, so that you don't have to put too much money and too many surprises into the regulatory process, because that's the last thing you want. So that's the vision for the xShare label. We will have an xShare label that will allow for a self-certification that is good, well integrated with all other types of labeling and certification that need to go into these products, so that it's a one-time only process, and that you don't have to redo the steps elsewhere. How that's going to happen, we don't know yet, but that's what we're working on. Any questions on the industry label? I haven't done it as nearly much as justice as Nathan would have done, because he's much younger and much more enthusiastic than I am. So I'm very happy to have him on the team and to actually lead this effort, because this really needs his enthusiasm and energy. Andreas.
First remark, the box you have on the right side updated, being an industry representative for the others here in the room, is of course something which makes industry very nervous. Of course, this is part of the regulation, that there can be more complex certification than via the national e-health authorities, but 27 of them. And then getting a product in the market which probably requires then 27 of these labels. I don't know, maybe 28, because there's a European one, and then for each member state a special one. That is not really something which makes the industry very, very happy, of course. But there's nothing xShare can do. This is part of the regulation initially anyway. The other point is, you rightfully say, it should be as lightweight as possible. And especially regarding the self-certification, indeed a misnomer to a certain degree, because our expectation was it would really be a self-declaration, and we wouldn't have to go somewhere else to make that statement, like essentially like it's done with IHE integration statements or something like that, where the vendor just makes a declaration, yes, we support these profiles, and it's up to the vendor to determine what we have to do to come to that conclusion. Unfortunately, it seems things go in a different direction. Yep. Then indeed there will be a testing infrastructure operated by member states, which has to be used by vendors, which makes it more potentially like a certification instead of a self-declaration.
Yeah, that's true, and of course there's now discussions in 27 member states how to do this, how to set up such a service. Based on a software platform that is being provided by the European Commission as kind of the blueprint or the box that you can use to actually set up this service. So a lot will happen there, and we don't know everything yet. But this is at least our vision for the xShare label, and hopefully we will be able to address some of these challenges as part of the xShare project and as part of setting up this label, so that we get clarity together with the member states on how this process is going forward, and we rely on our industry partners, both MedTech Europe and Digital Europe, as well as xShare, to inform us of what's going on and how we can relate to what's happening in the European Commission and across the member states, because you don't want to go somewhere at 27, 28, 29 times. So. Yes.
I'm confused if xShare label is like a generic interoperability label or something more specific. And for example, I would expect that it would be nice for you to force, let's say, an interoperability framework like FHIR, and say that if an EMR doesn't have like FHIR resources and stuff to connect with to share data, it shouldn't be published like from 2027 or something. Is something similar, xShare label would look like this, or this is what I'm saying is something different?
Even there, I'm not quite sure what the decision will be. Of course, the FHIR labeling or the FHIR conformance should be part of the industry label, because that's what's behind the yellow button, and all this starts and complements the yellow button. So that will definitely be there, but there's other things that are being studied as well. As part of the EHDS project, Sen has led the work in embedding the interoperability requirements into the requirements for health and wellness apps. And that's also being used in other countries to inform teleconsultation and telemedicine setups and labeling those services as well. So we still need to figure out, and we're doing, of course, a pilot, I think in Spain, in Catalonia with Tixalut, to actually test which parts of the frameworks that we know about are actually applicable to be used as part of the xShare industry label. So those choices of what it is going to be, how big it's going to be, we still need to make those choices. But if we want to test things now, just like Greece is already implementing the format right now, we are ahead of the specifications, and we take a guess, of course, a well-informed guess, that the specifications will be fairly close to what we're testing against already. So hopefully we won't get too many surprises once the European Commission actually publishes its implementing decision on what the format looks like. It would be bad if the people in this room would be surprised by what the Commission actually publishes by then. So I don't think that's going to happen. Charles.
Yeah, good luck.
Thank you. Sounds like an encouragement.
No, it's so two advice on how to increase the likelihood from 0.5% of this happening to 5%. Don't mix your label with other labels. Stay away from all of the security and safety labels, the CE marking and all of those things. Stay away from those, because if you try to associate with those, they will kill you along the way. They are complex, they have their political strings, they have certified bodies, a whole mechanics that has 30 years or 40 years of history.
I know.
Stay away from those. You cannot emerge if you try to be with them. So be independent, be the little Lilliput, appear on the market, be used on the market. Vendors don't care. They already have 20 labels, 21st, who cares? there is one more, one less. But keep it outside of those other levels that have all their strings attached. Otherwise, you're making your life a nightmare to decide on how to align with those. That's not useful time spent. It's time that would be, in my opinion, wasted. The second advice is there are actually two parts to the level. There is the visible part, which the level should address, which is what's happening between my app and a server, or a server and one or more apps that are connecting. So this, the real, I would say, yellow button interface. Stay away from the behind-the-scene infrastructure, because the behind-the-scene infrastructure will have all bunch of national variations. Will be deployed sometime, as we heard in Greece, as part of a national portal. In some cases, it's going to be deployed as part of hospital portals, and anything in between in all shape and forms. And if the xShare label is trying to say anything about those things, you now become hostage to 10,000 variants of things that are going to be a mess. So don't be hostage to the mess. Focus on the value add and the visible part that you bring. I believe with those two conditions, you are increasing the chances of success by a very, very large factor.
Thank you.
Charles, I think that there's a bit of a challenge. My understanding is the xShare label is not only about the yellow button, right? It's about the format.
Yeah.
Right, the format to be transferred. It's about the interface.
Charles, we are required to certify that interoperability component in every of our apps, of our products, which is unfortunately also, most of that is actually on the infrastructure level, what you are saying, which has this impact from the members.
Well, they should stay away from that.
Yeah, but they can't.
They have to.
Let's continue that discussion over drinks. I would be very interested to hear your insights.
The vendors agree that this is a choice made with the level. The level is covering this part of the integrity problem.
Yeah.
I think that's going to create a meaningful context and relationship. Stay away from the big EHDS compliance, because that one will never exist. So don't become dependent on it. It's so complex that one will never land anywhere. And if you want to make your xShare label land, don't count on the EHDS, EHR compliance to be a help. They'll sink you. They are a huge anchor that is so heavier than you are, then the little xShare label will sink with the rest of and I don't think it should sink.
I didn't want to try this to XDS or something like that. Again, the challenge is we have to implement this interoperability component in things that are called EHR system or EHR system. And we have to certify that this is working. And my understanding was we could show this, that we do this then with the xShare label, right?
Yeah.
So, which really transcends into even what is going on inside the hospital, because that's where these interoperability components are and then are running.
Yeah, but in all honesty, I have to say that we wrote this down before the agreement which introduced the interoperability components and the digital testing environment. So we still have to select which way to go. And I really value the discussion here to inform that discussion. Unfortunately, again, Nathan is not here to respond and take it in, but we'll be sure to communicate it with him. So I was also asked for the next part to say a little bit about how to join xShare or work with xShare. And that's where we really want to stress that we are about collaboration. We're not doing this just as a project. We're not doing this just because we're getting paid for it, or we can get some of our costs reimbursed actually, because all of us are doing much more than we signed up to do. But we do want you to actually implement the xShare yellow button, whether you're part of xShare and a partner of the project or not. So we will publish the guidance through the EHRXF website and also through the XBundle registry. An XBundle being the set of things that you need to actually implement a yellow button, including the architecture, including the implementation guide, but also other materials and some of the software components that you can reuse. So that toolkit will also be accessible as part of the XBundles, and we also are developing services to help you with that. And of course, we're testing out those services with our adoption sites. So we are working with the Greek ministry, we're working with all the adoption sites that Fabio mentioned earlier, to make sure that we actually have the services in place to help them implement the yellow button. And we will also publish an open call. That's an open call for anyone who also wants to implement the yellow button for a specific use case. It could be, we already saw 5 different categories of use cases, and there might be more that you can think of. So anyone who has a plan to actually implement the yellow button can apply and can receive some funding and, but more importantly, support from the xShare community. To actually make sure that you're part of the game and part of the format and part of adopting the format for better care. So how do we partner? We will partner through the hub. The hub will be your partner, and the hub is what we call the European EHRXF Standards and Policy Hub. I'm still not sure whether we want to call it that, but we just call it the hub. So it's really about beyond the xShare project, because it doesn't stop with the project, and we knew that, and we know from experience that if you say in your recommendations at the end of the project that yes, this needs to be taken on by someone else, it doesn't happen. It just simply doesn't happen. I've seen it with the Unicom project around medication, where we said we need to continue the community of expertise and the collaboration with the SDOs. Nothing happens. So you have to make it happen during the project. So that's why we're setting up the hub right now. And the xShare project will be kind of the incubator for that baby hub that will be created. And hopefully the hub will be mature enough by the end of the project to stand on its own. That's only 1.5 years of growing up. For babies on the human side, that's far too short, but hopefully we can do better than a human baby. Yeah, baby on steroids. And hopefully we will be able to get some steroids, because some of this work that the hub does sounds a lot like the support center that the European Commission is looking for. So maybe the steroids will come from that side, but we'll see. So I want to stress that, yes, we are already somewhat in operation. We do have the website, we do have the XBundle registry. We are working with the adoption sites through Work Package 3. And we are testing our operations and developing our operations as we go. Hopefully, we will be more or less operational by mid-2025 at the time the open call starts, so we can be there to support you and to provide the services. Of course, it will be kind of the incubator environment, so we value your feedback on our performance. And of course, it's also really a neutral place for co-creation. So it's not just, we're not just a service shop. We're a place where we can work together and continue to work together in extending the format, in implementing the format, and in actually having an impact on patient care in general. So that's what we want to do. and look forward to the open call and your responses to them. Any questions? You're welcome.
So just before we close, I will invite again Fábio to the floor to present the current version, let's say, of the implementation guide for the yellow button.
And if I may, sorry for interrupting. Just a clarification, we will be developing the connection between Greek hospitals and the new EHR system using FHIR, finally. I just got this information from our technical implementer. Yeah, just to clarify.
It's possible to open the first presentation.
But we have seen that one.
No, but is the link for? It's here. I have the possibility to click on this link and open the web page. Yes.
We have 6 minutes until the end of the session, so just
we showed the link.
Just pinpoint the most important parts, and the link will be there if
exactly.
you need to check it.
Okay. Thank you. So this is the home page of the xShare project Yellow Button implementation guide. This is a work in progress, so the idea is to put all the information regarding the yellow button here in this implementation guide, helping the institutions that want to implement the button in their organization. So the first tab is the X-bundle registry, as Robert mentioned, is a connection to where you have all the assets related to the exchange format and so on. You can then open, and you have divided by priority category. So the FHIR implementation guides, the health network guidelines, and so on regarding the exchange format. Then we have here a Get Started tab that for now just have the download functionality. We'll add the on-time share and also the link options. So the institution can understand what is needed to start to use these functionalities of the button. Then you have the business scenarios, where you also have here the information from the labeling that Robert presented right now. Then the application with the sequence diagrams of these transactions that I already show in my presentation also. And the data, where you have the implementation guides available for now that you are using and consider it to be the exchange format for the yellow button. They are here. And finally, the technology part, where you will put all the information regarding the toolbox and the tools that are available to the implementation of the button. So this is the tabs that you have. We have many information there already, so you can check. So this is the sequence diagrams that I will show in my presentation. There we have also the main architecture that I present. And you have here, for instance, the download. This is just a first version of that, but we'll put all the information, what do you need, what is supposed to be worked on to have this download available, and also where you need to test and have the conformance to have this functionality ready to be used. So we're working on that. It's a draft version, but you can check, and if you have any feedback, you can talk during the coffee break.
Okay, any final comments or questions? So I'm not sure, will the slides be shared somehow, or we should handle it internally to the session? The presentations, the slides?
I'm not sure.
Okay, so...
we should ask Lina.
Yeah, okay, so we will ask Lina, and maybe we can find a way to share the slides, because I'm not sure if they will be shared with the participants like automatically.
Mm-hmm.
Okay, so now.
Oh, wait, Fábio. Maria can close it.
No, we can close. Okay, so I think that everything is more or less, yeah, please.
Yeah, one thing is going to be important is the various EHDS specifications are going to be evolving for the next 2 years.
Yes.
At an unplanned schedule. So it means that xShare will have to basically say, on this date, we take this spec, and we will keep on using that spec for the next 3 months, 6 months, at which time we will consider the necessary update. Have you defined already what is that first window where you're going to do a snapshot and take that, and for how long you're going to take those? To me, setting this framework that make you in sync but somewhat independent is probably the most critical question that any respondent to the call for participation is going to ask. I want it, and I need to understand what it is. That's, to me, something you should work on. And that can be decided today. You basically, you know your schedule. The rest of the project has a theoretical schedule that I don't trust. But you know your schedule, you paid for that, so I believe that you should set those dates, at least the first window. You may have a second window at an undefined date later, but that's
we are
to be
working
more.
currently with things that we consider that are more or less close, and we are focusing on that. And if we don't have more concrete parts for the rest of the activities, let's say, that may come to a point where we don't touch those. So we just focus on those that are already somehow more mature. And,
I know, but it's impossible to see and to find. This is part of a culture among an unknown number of people who have more or less agreed. I believe that is going to be the demise of xShare. If you don't exteriorize this, the EU Commission may get upset. The rest of the project may get upset, says, oh, please move your window by 2 weeks and you will get something so much more wonderful, because what you have today really sucks, is full of bugs. Announce your date. If they meet your date, good for them. If they fail your date, their problem, not the xShare project. Otherwise, you will become the victim, and as a result, the people who try to support your implementation project will hate xShare, and you'll be the victim between the two sides, and this will not be good for anyone.
yes, and that's a problem, or at least something to be considered, especially for the open calls.
Yeah, and don't optimize as you go. It's unoptimizable.
Thank you for all this advice, Charles.
Hey, that's what industry does when they build product. They say, sorry,
yes, it is true.
that's the best spec we had, and that's what the product is being built to. There will be a later version, but we cannot continue to be intercepting a moving target all the time. You build nothing.
That's true. At some point, you have to just make a stop and you
Right.
refer to the
But
point that
for
you are.
you, it's important to do it ahead.
Yes,
You
yes,
need
I
to
understand.
announce today that on March 1st, there will be a freeze, and you will take the spec as they are. And if they are not as the producer of the spec intend, it will be their problem.
Yeah. We will take that into consideration.
Welcome.
Thank you very much. Okay, so any other comments you want to
No.
before we close?
No.
So just thank you all for coming here and for sharing your thoughts with us. I think that's all in all quite productive, especially for the comments that we received, not only for the technical part, also for this part on the labeling and the open code. It was very, very no, you didn't. You didn't. So, thank you all and have a great rest of the day.
Thank you.